There we go. Okay. Hi, Shannon. So, as I mentioned in our preamble, I'm Casey Berard, which you already know, but I just want you to state your name and give me permission to use this interview anywhere on the internet that I feel like to help promote women's health and pelvic floor care.
Yeah, absolutely. I'm Shannon Carr, and I consent to sharing this video.
Wonderful. Thank you so much. Um, so I reached out to you a while ago and we've been playing Zoom tag back and forth, but I had a beautiful experience with you when I had my own pelvic floor issues and you came to my house and I just thought that was wonderful that there are professionals around who do that and care for people. And my first experience with pelvic floor physiotherapy was amazing. So I wanted to bring you on. My specialty is acupressure for labor and humans during their daily life. But I know there's so many people in Guelph and the surrounding area that I wanted to interview people and let people get to know people who might not go on video otherwise. You know, they're just kind of traveling from car to car and appointment and house and that sort of thing. So um, that's my little excitement about you. And then would you care to share your professional, little elevator pitch with people as we get started?
Yeah, absolutely. So, as I said, my name is Shannon Carr. I'm a registered physiotherapist. My clinical interest now is primarily in pelvic health, but I've been in practice for nearly 15 years and I have experience across the spectrum in orthopedics, sports injuries, a little bit of pediatric physiotherapy for infants under 1. And then the majority of my time is now spent in pelvic health, primarily people who identify as female or who have been assigned female at birth. And that includes prenatal and postpartum recovery. It includes childbirth education. It includes support through the menopause transition. And I am practicing in 2 locations. How I know you is through my mobile practice with the Village Physio and Co. It is a mobile practice that many people who may be watching from the Guelph area are familiar with. It's owned and operated by Robin Murray. So I spend 1 day a week doing in-home care there where I bring my bed and my equipment and I come right to your living room or whatever room you want to share with me and treat it like a clinic, and we get to know each other pretty well. And then the rest of my practice is at the Womb Guelph, which is a multidisciplinary clinic that currently is primarily servicing pediatric and kind of perinatal populations, but certainly has a wide variety of practitioners that specialize in any issues across the lifespan.
Yay. A big
Yes.
lifespan, big lifespan. This is such a special niche. And what got you into this? Because it's kind of a unique area that's been building over the last 30 years in Canada, maybe 10 years in Canada.
Yeah. So, it makes me a bad pelvic physio to not know when it started, but I would say that pelvic health awareness and training has certainly grown exponentially within the last 10 to 15 years. I graduated in 2009 and I practiced at a clinic that focused on orthopedics and sports injuries. And initially, when I was approached about learning about pelvic health, I was like, no, thanks. Like I hadn't had kids. I was just like not that interested. Not a lot of people were practicing it. It just felt like I wasn't quite ready. I had my first living child in 2015, and that was a rough time for me. I had a rough in first birth. I was probably grossly unprepared, in my words, for what can happen to the human body with a vaginal birth. So my first personal experience with pelvic health was in 2015. I had an amazing physio who helped me recover in many, many ways. Um, and that kind of got the wheels started rolling a little bit. My interest definitely peaked at that point, thinking, man, there's a whole area of the body that I don't talk to anybody about, I don't address, I don't, consider the, parity status of the women that I was treating at that time. Many of them were in university anyways. So, it
Mm,
wasn't really on my radar. And so I started to do some courses and read up on some athletic related trainings. So there's a couple of really excellent therapists in the world that specifically focus on the female athlete. Took those courses, got really interested, and thought, man, there's this whole population of women who their life feels altered after childbirth. They feel like they can't go back to their sport, or they don't know how to go back to their sport, or they're being trained by people and coached by people who have no appreciation for what their body might still be recovering from. And then in 2017, I experienced a significant pregnancy loss and took a leave from work. And when I came back to clinical practice, the company I was working for at the time had a position open up for pelvic health therapist at their women's health clinic. And I just kind of half jokingly shot an email to my boss at the time saying, whoa, man, what an opportunity. Like that would have really opened, that could have opened some doors. And she said, hey, the course is in 2 weeks. If you go and do it, like we'll cover you, you can do it. And then
oh, wow.
and then you can start the next week. Like we need someone right away. And I'd already been with the company nearly 10 years at that point. And so generously, that's how it started. And I hopped right in, and that was in 2018. And so I've been practicing in pelvic health since that time. I was doing still a combination of in an orthopedic clinic and women's health clinic for about a year. And in 2019, I moved over to a primarily pelvic health caseload at that time, and have been ever since. So now I have developed a bit of a niche, if you will. I do a lot of perinatal prep, but I also see people for any other pelvic experiences as well. So just continuing to expand my scope in that area.
It's such a great pelvic experiences. I love
Right?
that.
You got to
Because
keep
you're
it
right,
broad.
it's such an ignored, I think in all genders, it's an ignored area that our, the puritanical background of our ancestors just kind of was like, well, you pee and you poo, but like we don't really care about anything else down there. And
Yes.
even if it's that, we're not so keen on that either. Let's
Yeah.
keep that.
Yeah, and my clinical experience definitely leans like 96% towards assigned female, and the traditional feminine experience, if you will. But
Yeah.
certainly any other population that has a pelvis or pelvic floor, right? Male pelvic health is like grossly underrated, lots of really amazing research in that field, and yet
Yeah.
nobody wants to talk about it. And then, as we know, anyone who's undergone reassignment surgery or has
Yeah.
any other transgender issues that grossly underserviced, even more so, right?
Yeah.
So we all have a pelvis, we all have a pelvic floor. We do, it pees and it poos and it's sexually active, and it may or may not, be involved in the bearing of children. And it plays a huge role in our core and pelvic stability. So we
Yeah.
see a lot of connections between low back pain or people with chronic cough or
Mm,
abdominal issues such as hernia. The pelvic floor can play a really important role in all of those areas. And it's sometimes the missing piece. It's been recognized as a missing piece for a long time. And I think in some
yeah.
traditional settings, it remains that way.
Yeah, it's a huge education to say to people like, look, there's this one section of your body that has been completely ignored most of your life.
Mm-hmm.
Yeah,
Yeah.
until you really need to pay attention to it. Um, okay, so perinatal being like before pregnant, like at the sort of end, or is this a whole spectrum of working with pregnant people?
Yeah. So most people my clinical experience is that most people are hearing from their friends, oh, I went to pelvic floor physio when I got pregnant and they taught me about XYZ and it was great. And then I went afterwards too. So what is happening currently right now is I will get women reach out to me around the second trimester, saying I'm pregnant, and they may or may not have symptoms, meaning they might have pelvic girdle pain, they might have new onset urinary incontinence, they might have pressure or heaviness in the pelvis. Or I see a number of people who are hoping for an unmedicated vaginal birth, or who are hoping for a home birth,
Mm,
or who have heard about maybe something that sounds a bit scary to them, like pelvic organ prolapse, or they want to reduce the risk of
yeah,
perineal tearing. There's a lot of fear around childbirth and childbirth related injuries. And
yeah,
so I end up seeing a lot of people who are pregnant and get an opportunity to educate them on some of those conditions and the things that we know and the things that we don't know that may or may not help reduce the risk of injury. And then I will follow up with them postpartum, or sometimes our journey starts postpartum when people have symptoms that have lingered on from
right.
childbirth. So many of us have new onset pelvic symptoms that we don't like in the first 2 or 3 weeks. And then many of us, those resolve independently. Sometimes it doesn't, right?
Right.
Or
Sure.
they were highly athletic and they like to be able to go and be athletic again, but they don't know where to start and they've heard about injuries. So I see a lot of kind of really prophylactic, hoping for preventative support
Nice.
during, like,
Nice.
definitely during, yeah, I don't do any work for like preconception, unless they're symptomatic. Like I don't assist in conception in any way, but certainly, once pregnancy is on board and things are looking good, then that's where I come into play for the pregnant population anyways.
And is there like one thing that is not maybe something you'd be doing with the clients that you recommend over and over and over again for that peri? I might sneeze.
Please.
Achoo! Excuse me.
Bless you. So
Thank
something
you.
I find myself turning to is I have met several doulas now. I didn't have doula care during my
Mm,
pregnancy and birth.
births, yeah.
I wanted a doula for my last birth, but that is a pandemic baby. So I was unable
Oh,
to
yeah.
have a second support person in the hospital room in 2020. So I do find myself recommending doula support.
Nice.
Um, the literature is actually really clear that having a support person who is focused just on you during labor and birth reduces the risk of injury to mom or parent. It reduces distress in baby. It has, shorter labors, less likely to have interventions. There's actually like several, you are probably familiar with this research.
I
There's several
am. Yeah.
papers that are saying like, get help.
Yep.
So I usually suggest doula care, but appreciating that that is also a great privilege, then I will often recommend that whoever the birth support partner is going to be, whether or not that's the other parent or a grandparent that's going to be in the room. And this is something I would love to bounce off of you, Casey, is
I love your
what a
smile.
gift. Well, I mean, what a gift you have. Do you teach partners and other support people the methods that you are educated in, and how does
Yeah.
that work for you? So I've turned the mic towards you,
Yeah.
but
That is actually why I created the acupressure for labor, and it comes on an app with really short videos. I was kind of imagining like a self-identified male partner, like just treating them like football plays where they're like, oh, low back pain, click on the video and just see the picture and just have a quick, easy access. That's acupressure is such basic support, and it can help people who like deep pressure, no pressure. It offers emotional balancing too on top of physical stuff. So yeah, I really love acupressure as a like you can teach it to a 3-year-old and they could do it, right? And you can teach like it's easy to learn fairly quickly with these non-invasive points.
yeah,
Yeah,
wonderful. I do, I like to be generous with like again, my population is often cisgendered,
yeah,
hetero goals. And so I like to be quite generous with the dads. And I will say to my patient, like, listen, like, dads of our generation are doing great. They're doing a lot better than our dads did. Lord knows they're doing better than the dads before them, but they still
Mhm.
have no idea. And both of you going in for a first time birth, anything could happen. We're going to prepare as best as we can, but wouldn't it be great if dad had a skill set? And
Yes.
what sometimes comes out, I think, and I hate to generalize, but what we will see in those couples, anyways, is dad doesn't always know what to do, right? On the best of days, dad doesn't know what to do with big emotions, or dad doesn't know what to do when his partner is suffering in any way. And I think sometimes you don't know what you're going to want either. And wouldn't it be great for the partner to have a toolkit? And I do think that, you know, I've talked to the doulas I work with quite a bit about this, having one-on-one appointments if you can't afford doula support during
Mm.
birth,
Hmm.
or having, a one-on-one purchasing, access to your app. Those kinds of things can be so great, little affordable ways that the other partner can be invested in that time, because I think it's difficult to explain to people. And certainly I didn't know this when I was having my, certainly not my first. And then, even still with my last birth, not even as much as I know now, but it's such a distinct time. So many emotions, and we're all afraid of the pain, and we're all afraid of the injury, but we don't hold a lot of space for the possibilities of, what if it's not that painful, and what if we, how do we want this to look? What would we want instead? What do we want in that place? I feel like we are always worried about what it's going to be like, but we're not really envisioning what
Mm.
is possible in place of that. Does that make sense?
Yes, 100%. Yes, I'm drafting a course called Embrace Pain, Birth, Life. And that's exactly what I want to talk about in it, is how to step into that. I did an interview with a midwife from Orangeville, and she was talking about that. It's the one time we actually need pain. Like, pain is serving a purpose and it's helping
Yeah.
us, and to step, but so rarely in life is that the case, right? That we don't chase after pain in life. And in labor, you kind of want to, and those contractions help you through it. And the endorphins, we don't chase endorphins either. I
Yeah.
mean, we scroll endlessly for like dopamine hits, but
Yeah.
that's not the
Right.
same as endorphins. So, yeah,
Yeah.
there's lots of skills to learn that I hear you
Yeah.
seeing and hearing from your clients, that they don't have them, and you didn't even know.
No, I mean,
Yeah.
like a birth that's left uninterrupted would be called a physiological birth, right?
Hmm.
And we don't know. I didn't know about physiological birth, I didn't
Yep.
know. And again, this isn't a conversation about like the medical birth complex, but what ends up happening is, even when we choose the midwives and we, do the acupressure, the acupuncture, and we take the herbs and we do the things and we do the physio, and we're very prepared, we can't always account for what we can't account for what we might encounter once we stepped into some of those spaces. We don't know what a physiological birth, we've never been taught that. I
Yep.
think this is part of a grander conversation, but
Yeah.
we were taught for so long to avoid pregnancy, that then by the time we get pregnant, we have no idea like how our body is made to do these things. And I mean, like, no shade, I had 2 epidurals. I'm not coming for anybody when it comes to pain interventions and whatever. I've experienced many of them myself, and show grace for myself and what, Shannon back then knew. But I do think that the more people know about how their bodies work, about how oxytocin works, and what that changing pain could mean, I think if we knew more about those things, we would have an opportunity to lean in a little bit, right?
Yeah. And it is hard, to lean in, because we're moving out of our frontal cortex, which is where we're logical and think intelligibly, into like our more mammalian and reptilian parts of our brain, which, if we don't have practice with that, it's hard, and we resist it. Yeah. I
Yeah.
always tell a story of being a doula at an engineer's birth, where she was documenting her own contractions. And I was like,
Right.
how quickly can I get her away from
You're like,
this?
we're gonna just move that. away from you.
We're gonna get you out of your intellectual brain because it's
Yeah.
and I mean
And even
contractions
just
will naturally get you there eventually, but surrendering to that flow, yeah, very important.
and teaching the partner to, to recognize like this is where we're going and your job, I've started joking like their job is number one fan, number one cheerleader. I said, you are Taylor Swift to her Travis to Kelsey, so figure it out, like figure it out.
Yeah,
Like it
what does
doesn't, I
she
don't care if
need?
you're
Yeah,
hungry or you're tired. What does she need? Does she want you to be quiet? Great. Does she want you to keep talking? And so I do a little bit within my scope. It's tricky, right? But I do a little bit of that prompting with my patients, and then hopefully those conversations come home to
yeah,
say, how do you best feel supported? When do you feel the most loved? When do you feel the most safe? How can we move from that fight or flight that pain is going to trigger, right? You're
yeah,
going to get
yeah,
there.
absolutely. Yep,
Something is going to happen where you're going to feel a bit panicked at some point. How do we get from that into that like parasympathetic state, that rest and digest, that trusting the system, finding that flow
yeah,
state? Yeah, it is tricky to teach in a
yeah,
handful of appointments.
it's
Um,
true.
and I mean, you've mentioned this about Guelph. Guelph has many, many, many beautiful providers. We're very, very lucky now when it
Yeah,
comes to labor and birth support, in my opinion. That we, as allied health, we're kind of all on the same page. We're
yeah,
still working to break in to, certainly midwifery and definitely obstetrics, but I mean, my oldest is 9 and things are different now, right? So
they
in
are.
a decade, things have changed. So I have hope for the next decade, certainly when,
Yeah, me
we're
too. Me
like
too.
the old crones helping women, right?
And the internet is changing that, like absolutely. I have hope for that too. I do see good things on the horizon, and more support, more willingness to be supported too is the hard. We're a very independent culture, right? And birth has some interdependence. Like you need a safety net around you, and if you don't feel safe, you're right, it's going to be really hard to get into safe and social and surrendering to your what your body needs.
Yes.
Yeah. Okay. So you kind of answered my question about like recommendations that a pregnant person shouldn't be without. I'm going to say you said a doula, a supportive partner. Would there be like a third one?
Um, I think probably twofold while pregnant, keeping moving, right?
Yeah.
Having some movement that brings you joy. And if movement brings you pain, having a team around you who you feel can help relieve your pain. So whether that's chiro or massage or physio, um, whoever your favorite manual therapist might be to manage that. I think that the other piece is preparing for postpartum, because I do think that we spend a lot of time preparing for labor and birth. And
Mm.
that can be, if you're lucky, that's not too long. It's not too long of a period in your life,
Yeah, it's
right?
this little blip, right? Yeah.
Hopefully it's
Yeah.
just a little,
Yeah.
yeah, I will say to people, it's definitely going to be less than 48 hours for most of us, unless you're stuck in, but like for the
Yeah.
most part, the business side of things is going to be a short time. But um, both my experience, this is totally biased by my experience, but I'm also seeing this clinically where, boy, we just cannot be prepared for postpartum and what comes
Mm.
first couple days and weeks as well. So I love, I guess if I had to narrow it down, I would say find yourself a good mental health professional as well, right?
Mm.
Do you have boundaries? Do you like boundaries? How do you handle pain? What happens when you aren't the one who is doing all the meal planning and prepping? What happens when your partner goes back to work and you're
Mm.
on your own? I think because I'm doing proactive care, I see a lot of proactive women, right? I see a lot of women who
Mm.
are going to work as close to their due date as possible. They are going to have everything ready. They have all of the equipment. They have, beautiful registry. They have everything, trying to do everything
Yeah.
that they again, appreciating, like, I need a big asterisk on this, that like I treat it of, a privileged population. Okay. But as you know, as a parent, there's a lot of surrender, and you've mentioned this in labor and birth too, right? And so I think, yes, doula support and some of these things that you were mentioning are so beautiful, and hearing that message repeated, and then maybe having some mental health support on board too, for the fact that there's a major transitioning happening in your life, and a lot of surrender is required. So I do a
Yeah.
lot of like managing expectations,
Mm-hmm.
hold space for the possibility that it might be beautiful and you will recover fast and your pain will be minimal and you won't have an injury, but also holding space for the fact that, we know statistically somebody who hops on my bed is going to have a bad experience, right? Or
Yeah.
what they believe
Yeah.
to be a bad experience. And this isn't a birth trauma conversation, but we also know that there is a lot of birth trauma as well, or trauma
Yeah.
surrounding birth, and how do we handle those pieces? Or if you're a survivor, a trauma survivor, how are you seeking support through something that you do have to show such great surrender after you've maybe patched yourself back together and lived in survival mode for a long time? How do you
Mm.
prepare for something that's going to challenge that? So that's way off.
Well, it's
Very
kind of part of my
tangential.
questions because one of my questions was going to be, what are the things that you're surprised that pregnant people don't know?
Mm,
And I feel like I'm hearing that as themes is like, yeah, that we kind of aim for this one goal of like the baby literally coming out, but then we don't think about the surrounding and about our mental health and our physical health and our spiritual and
mm,
emotional health, like that we are a whole human being, not just this birthing machine that,
yeah. Yeah.
yeah.
Yeah, I think that, people who are pregnant don't always know that they can say no,
Mm,
right? So, they don't always know that the practitioner who will be attending their birth will be coming in with their own experiences and their own biases and their own ways of doing things that may or may not be evidence based. That some birth practices won't have yet caught up to what we now know in the literature.
yeah.
They don't,
That's been a huge thing that I've been
yeah,
curious about how to, the research practice gap is what we call it in
yes,
academia, right? And it tends to be 20 to 25 years behind. And the internet is making that more, it's almost like a vice grip now because humans might have information from the internet that's more advanced than their practitioners
yes,
got, and they just don't
yes,
know. And that like triggers the fight or flight again when you know all this information. And yeah, the
yeah,
practitioner doesn't. And they probably know how to help you have a safe and healthy birth. I forget, there used to be a little saying that people would say, like, healthy baby, healthy mom was all that mattered, kind of thing.
yeah,
But what we define as health now is so much broader than just like heartbeat and breathing rates, you know?
yes, yeah.
Yeah.
And so something that I will remind people, many women come in afraid of tearing their perineal space. And I'll say, the evidence actually suggests the number one way to reduce the incidence of tearing is to have a safe and trusted birth attendant. So
Mm.
you need to trust your team. Who's on the catching end? And do you trust that person? And so
Right.
I think the midwifery model services that well because you meet every midwife in your pod. I
Right.
think obstetrics struggles because of the
Yeah.
nature of their teams and the nature of call schedules, and there's so much systemic in that
Yeah.
system that makes
Yeah.
that difficult. But that I also will tell people, that's where your partner comes in or whoever your birth support person comes in. They need to know just as well as you how you're hoping for this to go, or what is an absolute yes, what is an absolute no, what are some of the things that you need, and make sure your support person knows too. So if you are in transition. Let's say you're in the throes of the end of labor and you're in that flow state. How do we like protect that, right? But if you don't know that you're going to hit a flow state, if you don't know what physiological birth looks like, if you don't know that
Mm-hmm.
just centimeters dilated doesn't mean you have to start pushing right away. If we don't know this information,
Yeah.
and your provider is not giving it to you, then
Mm.
you end up making uh, sometimes that autonomy is perceived as being given to somebody else. Does that
Yeah.
make sense? Right?
A
That this is
100%. And the one thing that I always remember from birth is like you and I are fairly intellectual humans. And when you're in the birthing, like once you've got past 5 or 6 centimeters, you're not necessarily intellectual. So your ability to communicate in long sentences, your ability to get your points across, much harder.
much harder.
Yeah.
Yeah.
So I think that was the most shocking thing for me in labor was like I could hear all the thoughts in the back of my head and they did not come out my mouth
Yes.
other than in grunts or short sentences, you
Yes.
know?
Yes.
And that's something to prepare for, like all these nuanced things of being a mammal in the mammal experience,
Yeah.
right? Yeah,
Yeah.
frontal cortexes don't birth.
Yeah. No, it's
Like
gone.
intellectual.
Off. Right? And I steal this from Robin Murray, my colleague through the village. And I will teach people about having like a code word for intervention, right? So
Yeah,
usually people come in saying, I don't want an epidural. So I'll use that as my example,
great
but
example.
appreciating that this could be used for really any other intervention. But she recommends having a code word for epidural because you might get to 8, 9, 10 centimeters. You might be put into that transition stage. And when it's just playing with your brain, and you might be saying, like, I need it, I can't do it, I just like go get it. But if you haven't said, flip flop,
Yeah,
then partner knows not to actually go and get that nurse, but to increase their support.
yes.
What? Maybe it's just one more contraction. You're doing so great. I'm so proud of you. You're so wonderful. I
Yeah,
can't believe we're gonna get our baby soon. Why don't we take one more big breath? Why don't we change positions? Why don't we get up and move around? And
yeah.
then when she roars flip flop at you, then that's when you go and get some help, And I think that's really beautiful because, yeah,
I
that
do
doesn't
think that's
require that
beautiful.
frontal, right? That
Yeah.
doesn't require any of that conscious thought. Like, you can pick any silly word. It can't be a word that you're going to be
I
using in
like
a,
pickles.
yeah, right?
Something fun, but that's
Something fun.
dramatically different because people will have self-doubt when they're in pain. And I think that is absolutely a normal thing, no different than running a marathon, like runners do that. That's psychological training of like, oh God, I can't make it any further, but I'm going to go to that lamppost or I'm going to go to this. Yeah, I love all the mindset stuff that you're aware of, that you're planting these seeds. Well, you have the
Yeah.
women and birthing people there for the pelvic floor stuff. You're like planting the seeds that people aren't getting anywhere else because there is that um, lack of space in that area. I think that we just don't know we need yet. It's becoming more
Yeah.
as we talk more, as we build more community, as we see the gaps in the industry. Yeah,
Yeah.
we can
And
get people.
it's an accessibility and equity piece too, right? I mean, again,
Yeah,
like Guelph has lots of beautiful professionals to choose from. I can't speak to this being the same in a smaller rural situation,
so
and I
true.
can't speak to, I will sometimes see women who plan to birth at other hospitals, and I say, I don't know the practices that are typical at that hospital. And I
Yeah,
think sometimes that's the first time someone has heard, well, how they do things at each hospital might be different because birthing, as beautiful as it would be to just be person-led, is not, right?
no, it's so true. It's so true. That's where I love how we started with surrender. And I learned that with both my
Mhm.
births, that well laid plans go completely out the window once you're in that. It's almost like a lazy river, and then there's rapids, and then there's a baby, and you're at the in the waiting pool at the end of birth.
Love
And you
that.
need people tending to you there with food and
Yes.
tenderness and care and quiet. And that in traditional Chinese medicine, there's a tradition to have a 40-day mother warming time where there's more stillness and quiet and rest and gentle exercise and things like
Yeah.
that our culture does not have. We are, yeah, super
Yeah.
busy, super busy. Um, I'm just looking over, wanting to honor both of our time and also wanting to pick your brain. Um, I'm wondering what question. Do you want to talk about recommendations for pregnancy that a pregnancy shouldn't be without, or maybe a pain management strategy that you see miss, or pelvic floor management strategy that you see missing that people could do on their own? Maybe give them a little one of
Yeah.
those.
So if you have an unmedicated labor, then I mean, I think an underrated tool all around is gravity, right?
Mm,
So
mm-hmm,
movement and gravity. So when I'm wearing my strictest physiotherapy hat, we are movement specialists. That is, across the spectrum wherever we practice, that is something that we pride ourselves on. How can we move differently?
mm,
And we know that the body needs the uterus needs gravity to help work baby down, right?
yeah.
Um, so something that I often will encourage people is if you do nothing else while pregnant, do some deep squats,
Mm-hmm,
you
mm-hmm,
know, do some deep breathing,
yeah.
right? When you come to see a pelvic health physiotherapist during pregnancy, if we do a pelvic exam, our goal is to educate you on where the pelvic floor is, what it
Mm,
feels like if it's too engaged, what it feels like to relax and lengthen. Because many of us don't have good connections in this area
yeah.
unless we've had symptoms or, unfortunately, unless we've experienced a trauma in this area. Most of us, we pee, we poo, we have sex, we have periods, and then if we're lucky, we don't think about it any other time, right? So I view my job as like, hey, this is a part of your body that exists. This is what it feels like when you contract it, right? If we were shrugged
Mm,
shoulders, this is what it feels like when we relax it or
yeah.
lengthen it, like we're going to have to do when we push. The pelvic floor's job is just stretching it out of the way in order to have
Mm,
vaginal birth. So how do we help encourage that tissue? We encourage it by getting into some deep squatting positions, opening up through the back of the hips. So getting into modified child's pose or some cat cow, any sort of pelvic mobility towards
I
the
love
end.
those still. Those are so
Oh,
luxurious, right? Maybe
right?
that's the problem is we're so in like the grind, we forget about
Yes.
luxury and how like sensual and in yoga, the second chakra is water, the water element. So like I always picture that movement of like flowiness, yeah, and opening and yeah.
Yeah. And then my number one recommendation during labor is if you can get up and move, try not to get strapped to the bed. I mean, you're not physically strapped to the bed, so, you can edit that part
Yeah.
out if you, but try not to feel trapped to the bed with
Yeah.
IVs and monitors and things. All of those things can be removed from the wall. You can walk with an IV pole. You
Yeah.
can walk with if baby's doing well, then you can take the monitor off for a couple minutes and move around, or get onto hands and knees and do some rocking or some lunging. All of these things can be done on the confines of the bed. Each hospital will have different rules if you have an epidural about how much weight bearing through the legs you can do.
Mm.
And the impact of your body's response to the epidural might determine what you may or may not can or cannot do.
Yeah, of course.
Right? I've had two epidurals. One, I couldn't move my legs. And two, I feel like I could have gotten up and walked around, but it was hospital policy that I had to stay on the bed. So
Mm.
you
Could
don't know.
partners move legs, like birthing partners? Could they move legs or like
Yes,
rock
I
hips or
absolutely. Like, I
I'm always,
think yes.
yeah,
I'm an
thinking of
I'm
workarounds.
nervous. I'm nervous if there's complete numbness, which I wouldn't
Right.
recommend anyways, but if there is, complete numbness, then there's no feedback tool for you to give your
Right.
partner to
For
say, oh,
pressure
you're
and
going
stuff.
too far, right? Or like that
Yeah.
actually
Yeah.
hurts my hips, or
Yeah.
but if just one leg feels a bit heavy, you
Yeah.
know. And so then I also do a lot of education on alternative birthing positions, because we're all hearing don't push on your back, but nobody is showing people how else to push.
Mm.
So you can push on your side, and you can push on hands and knees, and the bed can be transformed to have a bar, a squat bar that you can pull into squatting, or the bed can be
Mm.
transformed with the head of the bed up, and you can hang on to the back of the bed,
Mm.
and you're pushing and birthing, the
Yeah.
person pitching you is behind you. I
Yeah, these are
usually,
all things people don't think about. They're not creative
yeah,
in their movements with their bodies. We kind of sit in
yeah,
chairs or we stand or we lie down. We don't do
yeah.
this
Or
dancing.
like you said, you're in that flow state, and this is where I say, like, tell your partner and tell your provider. If you can talk to your provider beforehand that, like, I want to try all the positions, I don't want to be like this, because we're set up in that way so that the provider has the best field of vision. And I know that
Mm.
that gets, poo-pooed a lot, but that's how they've been trained, right? We're a good generation away from having everybody that catches babies know that they can confidently catch a baby when a woman is on all fours,
Yeah,
We're
yeah,
like,
yeah. Or
we're
in
getting
any
close.
position, like,
Or in any
yeah,
position, like baby's gonna
yeah.
come out if he wants to come out. So
I tell you, like parents who change diapers know if they have a walking baby or a moving baby, they have to change a diaper in any position. So if we
yeah,
can do that, I'm sure other professionals can do that too.
absolutely. And again, like, it'll come, but in the meantime, what I'm usually arming my patients with is like, take this back. If this is interesting to you, these are
Yeah,
some of the things that we think reduces the risk of injury. So why not go talk to them and say, have you delivered? Or, like, some people don't like that word, but have you been at a birth where someone's birthed like that? Have you caught a baby when they've been in that position? How
yeah,
comfortable are you with that idea? What would be your hard nose, right? Like,
yeah,
so
yeah.
what, because I also don't want an OB that I'm saying, can you do this? And they've never done that before. I don't
Right.
necessarily want to be the guinea pig. I want someone who confidently has attended a birth and done those
Or is
things.
open to talking about it too. I think a lot of dialogue beforehand, like if we, in some ways, they're almost like a sexual partner in that they're going to be in our most intimate space, that you can create a dialogue back and forth with them about how
Yeah.
you'll dance together as birthing partners in some
Yeah.
ways. It would be an interesting
Yeah.
mindset shift.
Yeah, or the
Yeah.
nurses at least, right? The nurse is gonna do most of the heavy lifting, so
It's true. It's true. Yes, I've had a home and a hospital birth. So yeah, I recognize that different dynamic and the different, it is like building a relationship in a very short amount of time.
Yeah.
Yeah,
Yeah.
with people you trust.
Yeah,
Yeah,
and it's hard to trust people right away. That's human nature, you know what I mean? We
totally.
wanna trust the perceived expert, but again, we all have friends, family, or our personal experiences that make trust with the medical profession difficult, and the internet is beautiful, but I do think the internet is making that even harder,
Yeah.
and, for many, many reasons, okay? I see both sides in this, but
Yeah.
when I'm saying, get to know your doctor as best as you can, because hopefully that's the one. Or I've said to people at, 36, 37 weeks, I'll say the call schedule is out. Like, we know in and around your
Hmm.
estimated due date, who's going to be on call, and are they on
Right.
rotation? Like, are they a member of the same clinical practice? Can you meet that person? Or can
That
you
is
just,
great information because people
right?
don't think about that. Yeah,
Yeah.
absolutely. Yeah.
Yeah.
They
So,
assume they're going to be ushered through this sequential thing, but medical is not like a customer service based
yeah.
system yet. So maybe one day. But
Maybe. Yeah.
yeah, so there's information that we can share. That's really helpful. Would never have thought of that. That you can get to know the doctor who will be on call
That would be
closer
lovely.
to your dates. Yeah. So that being said, when should people come to you? And how
So,
long do the visits typically last?
So my initial assessment is 1 hour. and my
Okay.
follow-up appointments are between 30 and 45 minutes.
Okay.
If we're doing an internal pelvic exam, which I haven't discussed here, but if we are doing a pelvic exam, I usually recommend that people wait. If they have symptoms, I ask that they wait until about the mid-second trimester, so 16 weeks or more, for internal assessment. Certainly, if you have back pain, pelvic pain, round ligament pain, I can see you anytime through your pregnancy. There's no documentation that an internal pelvic exam would cause harm to the pregnancy, but we want to know placenta settled. We want a couple of ultrasounds under our belt. We want to be associated with the good stuff, you know?
Nice. Yeah. Keeping.
Yeah. For people who are looking for just birth prep, who are having symptom-free pregnancies, then I usually recommend that they come in for their first visit around 24 weeks. So they've had their anatomical ultrasound. We know the placenta's in a good place, hopefully. We know baby's happy and healthy in there. And I usually, in an ideal world, we'd have at least 4 appointments before the estimated due date. So around
Okay.
24, 28, somewhere between 30 and 34, and then between 34 and 38. I
Nice.
particularly kind of like around the 35-week mark and the 38-week mark. At 35 weeks, if you're going to choose to do perineal massage, then that's when it would be clinically indicated to learn how to do that. And so I do teach that to people who would like to learn. And then around 37 or 38 weeks, I would do some push prep. So I actually
Hmm.
have women perform some pushing while I'm doing an internal exam, so I can give them some feedback about, are we getting good descent? Are we getting the pressure where we want the
Yeah.
pressure to be, or are you just pushing your bladder down, or are you,
Right. That's the
right? So
easiest one. Yeah.
yeah, right.
Yeah.
So again, appreciating that if you are left alone, your body's going to push the way that you want it, that it wants to push, right? But I would say 50% of the time people are like, hey, I remembered that and I could do that at the time.
Nice.
Lots of other people say like, I tried, but then, I
Just the
don't know, this other way felt right. And it's like, great, we got baby here,
nice.
whatever.
Yeah. Yeah. Nice.
Yeah.
That's okay. So I'm hearing from you 35 to 38, but for sort of from 24 to 40 weeks
Yeah.
for birth prep and keeping people healthy. And what's your favorite way for people to get a hold of you?
Usually through the booking websites at the clinic right now. I don't
Okay.
have a lot of
That's
public
okay.
social media, but yeah, either through the womb Guelph or through the Village Physio.
Okay.
The Village is where my home care practice is. It's a little bit of a longer wait time just because I do that only 1 day a week.
Yeah.
My wait time at the clinic is about 4 weeks for an assessment right now as well. So
Okay. Yeah.
I
The
like,
midwives were saying that too. Call as soon as you get your pregnancy test. So with
yeah,
physio, if you're pregnant and you're thinking you want some support, like booking a month ahead, you're going to need a bit of
yeah.
lead time. Okay. That's
Yeah,
great.
I love it. Thank you so
That's
much.
great. Oh, thank you for coming on. I really want people to learn more because and learn more from innate experience, not just sound bites, right? That we can have a whole conversation and see an arc of what's going on and how we get there and that getting there might be a bit bumpy, but
Yes.
we will
Yes,
get there. Yeah.
humanity.
Yeah, it's so part of being human. Absolutely. I feel like I could talk to you for like another 6 hours and pull information out of you, but I will start at the beginning and we've got the general gist of how a pelvic floor can help perinatal. And you do some postnatal stuff too, but we could maybe talk
Absolutely.
about that in another.
I would love that. I love
Yeah.
postpartum recovery. So yeah,
Nice,
stay tuned for part
nice.
two.
Yeah, when I'm doing the mother warming stuff, once I get there, I'll draw in the postpartum stuff too. Yeah, perfect. Well, thank you
Okay.
so much, Shannon, for joining
You're
me.
welcome.
And I wish you a wonderful rest of your day. And we will talk later.
Absolutely,
Yeah,
Casey. Thank you so much.
you're welcome. Okay, be well.
Thank you.
Take care,
Take care.
Shannon. Okay.